Good evening and welcome, guys. If you are able to hear me, just give me a quick nod, a quick thumbs up, a yes. Am I audible and visible? Is the voice quality clear, guys? Just give me a quick nod so that I can begin with today's session. Yeah, wonderful. So, welcome to Anesthesia Simplified on this wonderful platform of Unacademy. I am your mentor, your educator for the subject of anesthesia, and in today's session, we will be discussing about the last minute revision tips and tricks, the MCQs, the important topics for the upcoming AIIMS examination, right? Why do you have to study all the minor subjects? As I've time and again told you that these are the ones which will actually tell you take your rank from 100 to in single digits, right? The bigger subjects which are there, they are fine that you can easily crack within top 100, but when you have to crack from top 100 to top 10 in single digits, this is the one that the minor subjects are going to be dealing with, right? So let us have a look at today's session, what are we going to be dealing with. And let us start first with the image based questions, right? So we are having some images which are there for you guys. Let us have a look at the first thing. This circuit which is being shown into the figure is the circuit of choice in cases of controlled ventilation, in cases of spontaneous ventilation, whether this can be used both for controlled and spontaneous ventilation, or it cannot be used for any of the following. Yes, so give me your answers in the comment section. Yes, guys, I'll be waiting for your answers. Is it option A, controlled ventilation? Is it option B, spontaneous ventilation? Is it option C, both it can be used for controlled and spontaneous? Or is it option D, that is none of the above? Yes, Dr. Munindra, I'll come to your question as well. Since you are a third year students, how do we have to prepare for the AIIMS and upcoming NEET PG? For you, it will be next. I'll be dealing with that also at the end of the lecture. Okay, I've got multiple answers. This is a single best answer type of question, people. First, you have to identify which type of circuit is it. Yes, whether this is a Mapleson type of circuit, whether this is closed circuit, whether this is open type of circuit. Yes, what is this circuit? It is a Mapleson type of circuit. Mapleson is a semi-closed circuit, right? So in this also the semi-closed circuit, which is this exactly correct, Staffy. It is Mapleson type A, that is Magel circuit. It is the correct answer that you have given, Staffy. It is Mapleson type A, that is Magel circuit. That is the other name for Mapleson type A. Now tell me whether this circuit is used for controlled ventilation or whether this is used for spontaneous respiration. I'll just give you a quick hint here. How do you actually go about with this? Whether the circuit of choice when it comes to adults and when it comes to pediatric population. Yes, how do we define it? And remember, this is only for semi-closed or Mapleson system of classification, right? In adults, again, it is divided into spontaneous and controlled ventilation. In pediatric, again, it is the same, that is spontaneous and controlled ventilation, right? So tell me the circuit of choice for spontaneous respiration in adults or spontaneous ventilation in adults when it comes to Mapleson system of circuit. Which is that, guys? Yes, I am getting a lot of answers. Yes, Taffy, that is correct. And for pediatric also you have given the correct answer. Wonderful. Yes, Dr. Subhendra, that is the correct answer. For adult spontaneous respiration, it is Mapleson type A. And for controlled ventilation, it is type D or Bain circuit. That is correct. Yes, Dr. Raman, Dr. Avtar, Dr. Safi, that is the correct answer. What about pediatric population? For spontaneous and controlled ventilation, which is the circuit of choice? Yes. For pediatric less than 20 kgs, that is correct. For both the cases, that is spontaneous and controlled, it will always be Mapleson type F, or we call it as Jackson-Rees modification of IRS-TPs, that is Jackson-Rees circuit. Yes, and pediatric circuit, as you have rightly pointed out, Dr. Subhendra, it is used in cases of if the child is less than 6 years or if the weight is less than 20 kgs. Yes, so that is the correct answer that you have given. So wonderful, guys. So the correct answer here is going to be what? Option B, that is spontaneous ventilation. This is the circuit. It is nothing but it is Mapleson type A or Magel circuit, and this circuit is the circuit of choice when it comes to spontaneous ventilation under anesthesia. Yes, guys, clear about this topic? Shall we move on to the next? The following catheter is used for, as you can see into this figure here in the lower end, that you can see the following catheter is used for: option A, embolectomy; option B, urinary catheterization; option C, arterial pressure monitoring; or option C, that is CVP monitoring, central venous pressure monitoring, that is called as, right? So the following instrument catheter is used for which of the following? Yes, I am getting some answers, people. Dr. Sai says it is option C, that is arterial pressure. Dr. Amit Kumar says that it is arterial pressure monitoring. Dr. Nurain says, Dr. Subhendra says yes. Dr. Staffy, Dr. Staffy says it is A, embolectomy catheter. Okay, as you can see here, this is the catheter actually which is there, and these are nothing but these are the 3 ports. Okay, guys, so these are the ports from which you can give the IV fluids to the patient. You can give some inotropes if you require, and this exactly from here, that is starting up till here, this is the catheter. Yes, it looks like a Schwann-Ganz catheter, but it is not a Schwann-Ganz catheter. It is a central line, yeah, that is called as, that is used for CVP monitoring, right? So this is nothing but a central line monitoring or central venous pressure monitoring catheter, right? Which is the main vein that we used, commonly used vein for this? No, it is not a Schwann-Ganz catheter. Schwann-Ganz catheter will have 5 ports. It will be somewhat similar, but it will be longer in length and it will have a cuff at the end. Okay, which is the most common vein which is used for this? Most commonly used or most commonly inserted through which vein? It is internal jugular vein. Yes, Dr. Sai, that is correct. Dr. Subhendra, it is internal jugular vein. That is the first preferred site, that is ideal site. Yes. So what is the most common complication which will happen when we introduce this catheter via the internal jugular vein? When we are introducing this catheter, so what is the most common complication that we can do in this? That is pneumothorax, right? Or accidental arterial puncture as well. And yes, exactly correct. Embolus can also be one of the complications, Dr. Amit, but that is not one of the most common. Dr. Sai, Dr. Fluff, Dr. Subhendra, Dr. Jay, all of you have given correct answer. Jay, yes, emboli, be it any of the following, thromboembolus or air emboli, it is common, but not the most common ones. Yes, most common ones are pneumothorax, which is the most common. Apart from that, accidental arterial puncture can be done because it is just lying anteromedial, anterolateral to the carotid artery. Apart from that, the side effect which is usually seen when you are inserting this, when you are inserting the catheter wire, that is known as because of the Seldinger's technique. Because of the Seldinger's techniques, when you are introducing it above the guide wire, what is the? Yes, I. It is correct. It can be used to remove air emboli. I agree with you, and that is why we usually put this when it is for the head neck face surgery, particularly of the posterior fossa of the neuro brain surgery and in sitting position. Yes, this is one of the very common indications for using CVP pressure, CVP line when we are using it for the neurosurgery in sitting position. Wes, what is the side effect of this? It is arrhythmias. When do we get arrhythmias? Yes, people. When it goes into the right atrium and it actually abuts the wall of the right atrium. Yes, arrhythmias, that is correct, Dr. Sai. Yes, Dr. Raman, arrhythmias when it abuts the wall of the right atrium, when it enters the right atrium, the wire when it enters the right atrium, we get arrhythmias. So the correct answer to this image is it is a use for CVP monitoring. Yes, another thing that can be asked for you is what is the normal value of CVP? Yes, the normal value of CVP is in the range of 3 to 8 millimeters of mercury. Right, guys? Clear about this question? Moving on to the next question, people. Identify this image which is shown into this figure. This is match the following type of question. So till now we are dealing with some of the important images when it comes to anesthesia. Yes, whether this is used for Macintosh blade, whether this is used for Miller's blade, whether this is used for McCoy's blade, or whether this is a McDoshie's blade. Yes, what type of blade it is. Yes, these are laryngoscopic blades. What is the name of this blade and where it is used? Yes, exactly correct, people. Straight blade is Miller and one is Macintosh blade. Wonderful. One is nothing but it is a curved blade. Yes, this is a curved blade which is used in adults. Wonderful, people. So Macintosh blade is used in adults, and the second blade which is there, yes, option 2 is, yes, it is option B, that is Miller's blade. So Miller's blade is used where? It is used in cases of pediatric population. Why do we use a curved blade in adults and why do we use a straight blade in cases of pediatric population? Remember, because of the airway anatomy. What is the airway anatomy? In pediatric population, the larynx and the glottic opening is superior and anterior as compared to adults. Yes, Dr. Rocky, it is correct. Yes, Dr. Munendra, it is used in pediatric. Yes, Dr. Munendra, it is used in airway because of the airway abnormalities, airway difference that we get. Yes, Dr. Staffy, it is correct answer. In pediatrics, larynx is anterior and little superior. So for this, along with that, there is the epiglottis which is very much floppy. So because of floppy epiglottis and superior larynx, you do not use curved blade because curved blade is not used for lifting the epiglottis. Yes, straight blade, as you can see here, it goes beyond the epiglottis and it is used to lift the epiglottis. Yes, Dr. Avatar, that is the best answer that you can give for this question. Straight blade is used to lift the epiglottis, which is used for intubation techniques in cases of pediatric population. Right? So till now we have seen some of the images. We have seen some images pertaining to the instruments. We have seen some images which are very high important points with the single best answer type of questions when it comes to AIIMS, right? Now we will be dealing with some of the other questions in the form of single best answer type of questions, in the form of match the following, in the form of multiple true and false, so that you get an overview and a hang of how the questions can be asked for the AIIMS examination. Are you up for that, guys? Give me a quick nod, a quick yes, so that I'll begin with the next set of questions. Okay, so here is the next set of questions, which is match the following type of questions on your screen. On your left hand side, you have got the cylinder gases, that is medical gases that we use for cylinders, and on your right hand side, you have got the color coding of those cylinders. Yes, when you have everything at one place, when it was a single best answer, I bet everybody would have given the correct answers. But when it is a mix and match of everything at one place, that is, it is asking 4 questions in one question, that time it becomes a little difficult for you to recollect. Therefore, this is kind of a revision for you to recollect all the cylinders at one place. I have already started getting some answers. Wonderful. Dr. Ankita says N2O is C, that is black body with white shoulders. Okay. And rest of the people say 1 is B, that is blue. That is wonderful. Dr. Subhendra has already given all the 4 answers. Yes, guys. Wonderful. I am getting a lot of answers and a lot of you are giving the correct answers. Yes. So, nitrous oxide, as I always tell, it starts with N. N in Hindi stands for Neela. So, it is blue in color, right? Nitrous oxide is blue in color. Oxygen, remember the mnemonic with the chemical formula O2. That means it is two colored cylinder, right? So, it is black body with white shoulders. That is the correct answer, guys. So, 2 is C. What about the third one? Yes, Dr. Staffy, that is correct. Carbon dioxide, CO2. Yes, C and gray. When you want to write G, how do you write? You write C and then you just put a extra effort to make it G. So when you are writing gray, first you have to write C. So always remember, carbon dioxide goes to gray, right? Carbon dioxide is gray in color. Cyclopropane. Cyclopropane is the odd one out. Yes. It has got O in that spelling, orange. It ends with E and this also ends with E. So cyclopropane is the odd one out. That is 4 stands for E. That is orange. Right, people? So most of you have got this as a correct answer. So we are moving on to the next question now. This is multiple true and false type of question. Yes, this is regarding CPR, multiple true and false type of question. Option A, push hard at the depth of 5 to 6 centimeters. Whether this is true or false. Option B, the frequency while giving CPR should be around 100 to 120 per minute. Whether this is true or false. Option C, the interruption time between anything, right? In between the CPR, when you want to check the pulse, when you want to shift, what should be the interruption time? It should be less than 20 seconds. Whether this is true or false. And the quality of CPR is determined by the end tidal carbon dioxide, that is EtCO2 reading, capnographic reading of more than 10 millimeters of mercury, right? So whether this option D is also true or false. Yes, I am getting a lot of good answers. So somebody are saying it is true, true, false, true. Somebody is telling false, true, false, true. The other people are saying that option A is true, option B is false, option C is false, and option D is true. Yes, Dr. Ankita, that is your correct answer. Dr. Vishal, you have given the correct answer. Dr. Sai says it is all A, B, C are true and last one is false. Okay, so it's quite a mix and match kind of scenarios. Remember, emergency medicine, in that CPR is one of the most important topics. Mark my words, guys, you will get 1 or 2 questions from the emergency medicine, of which CPR is one of the most important and most favorite topics for the examiners, right? It will just take half an hour to 1 hour to read this topic, and mark my words, you will get 1 question from CPR for sure in the examinations, because this is one of the most basic topics and you should have and you should know this topic in and out by heart, right? So first is push hard at the depth of 5 to 6 centimeters. Whether this is true or false. Yes, in adults we use the depth of 5 to 6 centimeters or 2.4 inches. Yes, so this statement that has been made is true. Yes, in children, in neonates, usually it is around 4 to 5 centimeters in depth, or if it is a neonate, what do? You push at the level of 1/3 of the AP diameter of the chest. Yes, so that is about chest compression depth. So depth of the chest compressions in CPR, this that is mentioned here, is a true statement. What about frequency of chest compressions? Before 2015, the frequency of chest compressions was made as more than 100 per minute. But after 2015, the newer guideline says that it has to be between 100 and 120 per minute. That means it should be not less than 100, it should be not more than 120. Yes, Dr. Amit Sinha, I'll tell you how does Entonox and Xenon also looks, don't worry. So I was telling you about chest compressions frequency. It has to be not less than 100 and not more than 120. It has to be in the range of 100 to 120, be it in adults, be it in pediatric, be it in neonates. Everywhere the frequency is same. So this is the true statement. What about interruptions in between CPR? Whether it has to be less than 20? No. Interruptions has to be always less than 10 seconds. Yes, interruptions when you are changing, when you are shifting of the hands, when you want to assess for the pulse, when you want to look for the pulse on the monitor, when you want to give the shock, anytime the interruption cycle should not be more than 10 seconds, right? So this is the false answer that is there. Option C is false. What about option D? Quality of CPR is determined by end-tidal carbon dioxide of more than 10 millimeters of mercury. Yes, Dr. Stafi, that is correct. It is less than 10 seconds. So quality of CPR, it is determined. Suppose a patient is brought to you and patient does not have any pulse. You have intubated the patient and now you are giving CPR, right? All the ACLS protocol now you have done. From the roadside, the patient has come to your emergency department and now you want to actually see after 20 minutes the patient is still not reverting back, how and when to stop the CPR. So your quality of CPR is actually determined by the EtCO2. If the EtCO2 is coming more than 10 millimeters of mercury when you are giving chest compressions, and that means your quality of CPR is good. That means the circulation going around is of good quality. But if your chest compressions are of not good quality, or if the EtCO2 level is continuously less than 10 millimeters of mercury for more than 20 minutes, that time you can take a call depending upon the history of the patient whether to stop CPR or no. So this quality indicator of CPR is very important. So this is a true statement, right? Less than 20 means 19 also. I did not get your question, Dr. Subhendra. Yes, I hope he is very talented, Dr. Munendra, but I am not getting his question. What is that? So Dr. Amit Sinha has asked about Entonox cylinder and Xenon. So Entonox looks like it is a blue colored blue body cylinder with blue and white shoulders, right? Moving on to the next question, which is there on your screen right now here, people. The capnograph, again the true or false type of question. The capnograph image shown on this here on your screen right now is of what? Is it a capnographic image of ET tube disconnection? Is it a capnograph of cardiac arrest? Is it a capnograph of tube dislodgement? Or is it a capnograph of tube kinking? True or false? Yes, all of the following can be correct answers. It is not single best answer type of question, guys. Yes, most of you are giving just single best answer type of questions, but it is not like that. It is multiple true or false type of questions that we are dealing with. Yes, A and C are true. Somebody is telling A is true, somebody is telling B is true. All different types of answers. Yes, Dr. Raman says true, false, true, true. I have got all the 4 answers with him. Dr. Staffy says exactly opposite of that. That is, first is false, third is false, fourth one is false, and only option B is true. Okay. Yes, guys. So these types of questions are gonna take a lot of time for your exams when you are gonna giving this type of exams. Though 150 questions will be single best answer type of questions, but these are the questions which will actually determine your rank when you are gonna be solving the MCQs of the pattern, that is the 7 patterns which are there, which are asked into the AIIMS examination. And you need to manage your time for solving these kind of questions, right? You need to take some risk, whether this is 1/5 or 1/4 of the negative marking, doesn't matter, but you need to take this kind of risk to actually come into top 10, right? So let us look at this. The capnographic image which is shown here is what? There is a normal capnograph wave which is followed by a sudden flattening out of capnograph, right? There is sudden flattening out of the capnograph. What does it mean? Yes, remember I've told you in my previous lectures also, capnograph helps us in determining what's one thing, it helps us in determining the ventilatory parameters. Second, it helps us in determining the circulation parameters. And third, it helps us in determining the metabolism parameter, right? So all these various functions is can be determined by one monitoring, that is capnograph. Yes, though it is a monitoring for respiratory system, all the three parameters can be determined by that. Now sudden flattening out of EtCO2 is a classical indicator of ET tube disconnection. Why? Because there will be no carbon dioxide in the monitor, right? In the tube there will be no carbon dioxide when you are connecting the capnographic monitor, the EtCO2 monitoring. When the carbon dioxide is not detected, that means there is no ventilation happening, right? Whenever ventilation is happening during expiration, you are for sure gonna be getting some amount of carbon dioxide. But when you are getting zero carbon dioxide, there is no waveform. That means there is no inspiration, there is no expiratory phase, nothing is happening. Yes, that means there is no ventilation happening. So under anesthesia, when does a patient have no ventilation? When there is no tube inside the patient. That means ET tube disconnection is happening, that is circuit has been disconnected or the tube has been dislodged. So option A is true, option C is true, right? What about cardiac arrest? In cases of cardiac arrest, there is no blood circulation happening to actually send the carbon dioxide from the cell to the alveoli and from the alveoli to be expirated out to the atmosphere, right? Yes, people, did you get this? So cardiac arrest also we get sudden flattening out of the EtCO2 graph. Now tube kinking is a dicey answer here, right? If it is a complete tube kink where there is no respiration happening, that time you might get this. But these are very rare scenarios which you get complete tube kinking. In partial tube kinking, you will not get these kind of EtCO2. You will get something like this peaking type of EtCO2, right? So this statement is not a completely true statement. It is a partially wrong statement. So that option D is false, right? Got this question, guys? A lot of you have given a blunderous of answers. I hope you know the topic. Capnography is very important. I have taken one entire session on YouTube on the Unacademy live platform. Yes, it does seems like all are correct. I am telling option D is not the completely correct answer. Yes, tube kinking. Yes, you will get a capnograph, but you will get this kind of capnograph. Yes, there will be some capnograph here, but a complete tube kink will only result in this complete flattening out of the capnographic waveforms, but that is a very rare possibility, so that is not a complete answer here. Yes, if it would have been a complete tube kink, then I would have gone for this, otherwise no. Yes, if there is no carbon dioxide, I think the graph should show flat line without any rays. Yes, Dr. Subhendra, that is what it is showing. It is showing a completely flattened out EtCO2. The one that you are talking about here, little bit, that is not a race, that is just a flattened out capnograph. Yes, don't get dismayed by that. Yes, I can see that you are pointing out to this little bit of rays here. Don't worry, that is a complete flattened out capnograph. Don't get dismayed or don't get carried away by that, right? Moving on to the next question, guys. It is a treatment for PDPS. So this is a question on complications. Complications in anesthesia. Yes, it is also again multiple true and false type of question. Treatment of PDPH, that is post-dural puncture headache. Which of the following can be used for treatment of PDPH? Yes. So we have discussed about monitoring in anesthesia. We have discussed about images in anesthesia. We have discussed about some of the most important parameters when it comes to monitoring in anesthesia. We have discussed about anesthesia machine and cylinders, and now we are discussing about complications in anesthesia. These are nothing but some of the important topics which you should know when you are going to attempt the AIIMS examination, the last minute revision. Yes, guys, I have started to get some answers, and most of them are saying that option A is true, option B is false, option C is true, and option D is false. Somebody is stating option A, B, and D are true. Okay. See, this is what happens, right? This is the difference between single best answer type of questions and when it comes to multiple true false, match the following, or for extended matching scenarios. Other than multiple types of MCQs, your concepts are not going to be clear, and until and unless you don't solve the MCQs in the examination, you won't be able to actually manage the time, right? So this is very important for you guys. Therefore, I am taking all different types of MCQs for you. Okay, let us solve this question. The treatment for PDPH. PDPH is was post-dural puncture headache. Yes. When does it start? It is usually started after a history, and you will see that the patient has received subarachnoid block. That is spinal patient has received. What are the conditions for that? Which are the patients who are more prone for that? Yes, elderly female or the female who is pregnant. One of the most primary indications in most of the elderly females is what we get this PDPH as a complication, right? That is one of the factors. Yes, we get it within 2 to 3 days of spinal anesthesia if the patient has received spinal anesthesia within 24 to 72 hours, but it can present as late as up to 7 days as well, right? It can present as late as up to 7 days as well. Yes, it is not necessary that if the headache comes after 3 days it won't be PDPH. Yes, it is a PDPH, but it has got specific symptoms. So what are the symptoms that will help you determine that yes, it is a PDPH, that is post-dural puncture headache? Patient will give a classical history of headache at the occipital and at the frontal area, right? And the headache will increase with the movement of the patient. With the movements, the headache will increase, right? And headache will be classical at the occipital and frontal area, right? When the patient is lying down and when the patient tries to get up, the patient will suddenly start complaining of a lot of pain. Why is that so? Yes, dull occipital headache. Yes, a large bore needle, multiple punctures. These are all the prodromal signs, or when you are giving multiple trauma to the patient and using large bore needle, that means the CSF is leaking out even after you have withdrawn the needle. So that is one of the very primary indications. And what happens when the CSF is completely leaking out? There is traction of the meninges, and this traction actually causes the headache. Yes. So understood the pathophysiology. So what is the treatment for this? We have seen the symptoms, signs, pathophysiology of PDPH. Now what is this? Yes, that is a cutting type of needle which is most commonly used nowadays as well, and that is also one of the most common indicators. Yes, if you have used cutting type of needle, there are high chances that patient might have a PDPH. Yes, large bore cutting type of needle. Yes, small pencil point, pencil tip type of needle, there are less chances for PDPH. Yes, because it is a separating needle, not a cutting needle. So analgesic and caffeine, yes. So is it a treatment? Yes, it is true. What analgesic do we give? Usually we prefer NSAIDs. Along with caffeine, it is used as a treatment for PDPH. Yes, that is a true answer. Head up position. As in the signs and symptoms, we have already mentioned that increase in movement will cause increase in headache, right? When the patient is lying down supine and suddenly patient wakes up or gets up, patient will suddenly feel unbearing pain, right? So that is head lying down position is a treatment, not a head up position. So option B is false, right people? Yes, paracetamol is a drug of choice that can be used for treatment of PDPH. Yes, that is correct, Dr. Sai. Hydration. Yes, it is because of the traction of meninges, because of the CSF completely leaking out. So we want the CSF to be formed faster, and because of that we provide adequate hydration to the patient. So option C is the correct answer. That is true. What about stellate ganglion block? Do we use stellate ganglion block for PDPH treatment? No. So option B is false. We use epidural patch. The invasive procedure is known as epidural blood patch. So the invasive procedure that we do for the patients of PDPH is epidural blood patch, right? Yes, there is sudden apparent decrease of ICT. That is correct. Coming to your questions, guys, the first Dr. Munindra had asked, sir, how can I prepare being a third year student, right? Being a third year student, you have to be reading your third year subjects. Along with that, you have to be reading your final year subjects with that, right? So most probably you will be the first batch which will be facing the next examination, first or second batch, right? So for that, your concepts has to be cleared. Right now, read your third subjects. Along with that, try to cover your final year subjects as well. And simultaneously, if time permits, try to solve the MCQs, so that this will actually build up your foundation and you will get to know which are the important topics. Right now, the primary target for you is to make your concepts as clear, as precise as possible, and try and finish off some of the topics, some of the systems of final year as well, right? Along with that, try to continue and solving the MCQs and giving the test as well, right? Any other doubts, people? Any other doubts, guys? Okay, so it was wonderful interacting with you guys. If you want, I can take one more session of YouTube in the coming week for you guys pertaining to the AIIMS examination. Yes, there are still some questions, some different type of patterns that I can take for you guys. If you want, I can keep one more session on YouTube just on this AIIMS pattern of question. And for all those people who want to take up and get to know about what next sessions I'll be coming up with, you can follow me on my Telegram app, Telegram group, which is Anesthesia Simplified by Dr. Hitesh. Yes, I'll send you the link into the comment section. You can follow me there and you can ask any amount of doubts that you want. You can ask me there. I'll be interacting with you personally there. Dr. Sai says anesthesia is my dream branch. Yes, Dr. Sai, anesthesia is one of the most upcoming branches for sure. It is one of the best branches if you want to work at any corporate hospitals, be it in the urban areas or even in the small towns. It is one of the most sought after branch, so most sought after people, right? You will never go out of employment if you are an anesthetist. Plus, yes, you have to be a little vigilant. There are emergencies without a doubt, so you really have to be motivated once you are there. Yes, this is a demanding branch, I agree with that, but simultaneously you get a lot of satisfaction also when you are an anesthetist and when you are solving out and when we are actually reviving a patient. Dr. Munendra, in cases of PDPH, the chances of or the cause of headache is not an increase in ICP. It is because of meningeal traction, which is there because of the CSF continuously leaking out, right? So if you are giving fluid to the patient, if you are hydrating the patient, the CSF which has leaked out and because of which the traction of meninges which is there, it will not happen and it will actually cause a betterment of your headache. The symptoms will improve, right? Clear about this? Welcome, welcome, Dr. Munendra. So this was me, Dr. Hitesh, your anesthesia mentor, and my referral code is Dr. Hitesh-YT. If you are trying for, if you want to go in for this Unacademy app. So till then, it is goodbye and good night from me, guys. I'll see you in my next session. I'll take up next session in the same manner, which is for the AIIMS examination. Yes, before your exams, I'll take one more session. Till then, it's goodbye, doctor.